Hi, I'm Dave Esposito. I'm a board-certified vascular surgeon. I work here at the Milford Vascular Institute, and we're going to talk a little bit about varicose veins. I think varicose veins are kind of one of the most misunderstood problems that people have. A lot of people look at varicose veins and they think that they're a cosmetic problem. And, you know, sometimes they are, but most of the time, varicose veins are a sign of something more serious that's going on underneath the surface. And that something going on underneath the surface is what we call venous insufficiency, okay? The veins' job is to take blood from our feet to our heart. The problem is gravity is pulling all of the blood constantly to our feet. So the way our body gets around this is our veins have valves in them. So as the blood moves toward the heart, the valves close and the blood won't go backwards. It keeps going in the right direction. Some people, those valves wear down, and that leads to a buildup of pressure in the veins. And then what happens is all the superficial veins start to get engorged from that high pressure. So you'll start to see varicose veins on the skin. They may start as just looking like little spider webs, what we would call spider veins or telangiectasias, or they can turn into these big ropey veins, these big varicose veins. And again, people look at them and they think they're unsightly, but again, it's because there's what we call venous insufficiency underneath. And untreated, those veins can not only cause symptoms, okay? So varicose veins can cause pain, swelling, itching, tenderness, can lead to phlebitis or thrombophlebitis and blood clots. They can bleed because the pressure is increased in those varicose veins. If you cut yourself where you have one of those veins, you can bleed a significant amount and lose a lot of blood very quickly. So there's a lot of serious things associated with varicose veins. So it's worth having them checked out. I'm not a plastic surgeon. I don't care what legs look like. Okay, I'm not treating varicose veins because I want your leg to look better. That's a side effect for me. We're talking about trying to fix a medical problem, and it's a sign of something going on under there. Men are the worst culprits because they'll walk around with these big veins and not think about them, but they should, because they can, again, be a sign of a very serious problem underneath. So my recommendation is that if you have varicose veins, you should at least get them checked out one time. If the doctor looks at them and says, there's nothing going on underneath, okay, but most of the time you're going to find that there is something, and that something can be treated. And in my opinion, it's very important that someone who checks you out is a vascular specialist. A lot of internists or other people who don't have vascular surgery in their background, they may not know or have the tools to evaluate you as well for these varicose veins. What you really need is to get a dedicated vascular ultrasound exam. We offer those at Milford Vascular Institute. If you come here with varicose veins, that's the first thing we'll do. If you're concerned about your varicose veins and your doctor won't give you any satisfaction, you come see us. We'll give you a consultation. We'll look at your legs. We'll do an ultrasound. And if there's nothing wrong, we'll send you on your way. But if there is, we'll get you in the process of fixing it. And fixing it these days is very simple. We have various techniques where we can use lasers or microwave energy. We can do injections. We can remove veins. And it's all done in the office. It's all done, under local anesthesia with almost no recovery, minimal time down, very little risk, very little discomfort. So it's really not worth it to let it go till it gets to the point where it can, be a serious risk to your health. So if you notice these veins developing on your legs, it's better to have them checked out sooner rather than later. So give us a call here at Milford Vascular if we can help you in any way, and we'd be glad to do that for you. So take care, enjoy the day.